big hello to all of our lovely class, all 7 of them, who are going to be midwifery leaders in Abu Dhabi in the future. So tonight's episode, we're going to share our updates on our admissions. We're going to talk about the recruitment process. How do we actually recruit students to this new program, which is a new concept in the United Arab Emirates. We're going to talk about the lengthy accreditation process that we've embarked on and that we're going through at the moment. We're going to talk about some of our teaching and learning strategies, how we've gone about beginning this program, and just to talk a little bit about the courses that we've run so far. Because like Gina said, our students have now completed 15 weeks of training and they've just done their final exams. And then lastly, we're going to talk about all of the networking collaborations that we've made, all of the midwives that we've met over the last year or more in Abu Dhabi, which has been really exciting. Just to tell you about what some of these photographs that you're seeing on the screen. The first photograph you can see there is me speaking at a leadership forum in Dubai, where I was sharing a platform with Professor Hannah Dallin and Caradine Aird, who is head of midwifery in Burj Al Farah here in UAE. You can see Caradine down below with myself and Dr. Gina at another conference that they ran recently, the Burj Al Farah inaugural midwifery conference. So you can really feel the passion for midwifery is growing here in the United Arab Emirates. We're becoming more empowered, we're becoming more vocal, and we're having really a bigger presence even in the last year or so. On the top right, you can see a pelvic floor made from clay, which is one of the teaching and learning strategies which we're going to be talking about this evening. And down below on the bottom right is one of our students, Mara, who is at one of our open days, because last week we were holding an open day to recruit for next year's students. Wow. It's really nice to see that development and see our students really bloom and grow and develop their confidence as student midwives. So the first thing that I want to talk about is just to remind you, for those of you who haven't tuned in, maybe you're not so aware of the situation, the status of midwifery in the United Arab Emirates. So just to remind you that it has been that we're in the minority. So midwifery actually comes, if you look at the resources that I shared as part of references for tonight, I've shared the scope of midwifery for the United Arab Emirates, and I've shared the professional qualifications requirements. And you will see that although we have a protected title of midwifery as per the international guidance, midwifery is actually a licensure within and under nursing. So that has been a barrier, I suppose, to the progress of midwifery so far, and there's just not enough of us. So we're hoping to build the workforce and have more midwives. So hopefully by educating more midwives, we're going to have that snowball effect to really spread the word about midwifery. And you will see in this photograph us proudly wearing our beautiful new purple scrubs, which were gifted to us by a graduate nurse, Sharina, who makes these scrubs. She has a business called Classy Scrubs, and she saw all of our social media posts, and the excitement was building for the beginning of our midwifery program. So when she heard it started, she reached out to me and she asked me what was the colour, the international colour for midwifery, and I shared that it was purple. And you can see she designed a logo. Maybe you can't see it so clearly there, but there is a mother and baby crest and the Fatima College on the other side. So she was really excited by helping us to express our midwifery identity. So this is really nice for us in the college to be seen visibly as different and as other, and it helped our students as well to feel like they are different, a separate profession. So our college is Fatima College of Health Sciences, and within that we have 6 different healthcare professionals. We have physiotherapy, radiological medical imaging, we have nursing, we now have midwifery, we have psychology, and we have pharmacy. So and paramedics as well. So have that midwifery identity as separate is really important, especially now to our student midwives who are really feeling it as they're progressing through their program. And we will have a different uniform for them as well when they do go to clinical placement. The nursing students wear navy, but our students will have a purple shayla. Yeah. So they will be identifiable as midwifery students in the clinical placement. So we're really striving to also spread the word in the general public about what is midwifery, what is the role of the midwife, and our students are already embracing that and bringing this information home to their families as well. So it's really been brilliant.
Yeah, and they're sharing, aren't they, about the advice that they're already giving. So they say, oh, Miss, I'm telling them to give folic acid and telling them about fetal movements.
Yeah, so they're really owning this midwifery identity, which is absolutely brilliant. So back in August, and actually throughout the year, really, we've been building this momentum towards starting this midwifery program. Gina started the hashtag midwifery in Abu Dhabi at the very beginning. Before I even joined, she started this momentum about spreading the word about what is midwifery. So back in August, we started making some posters. You can see the one in the middle. Did you know that the word midwife means with woman? Just to sort of catch people's interest, we put this up around the universities. We also did a major recruitment drive. We have 4 campuses in Al Dhafra, Ajman, Al Ain and Abu Dhabi. And we went around to all the campuses to tell them what is midwifery. We did some role play to give them an example of what does labour look like, what's the role of the midwife, what does the midwife do? And again, just getting that conversation going. And then at this point, we gave them information about what would the programme look like if they were to study midwifery. And it's a 4-year degree programme, but the first year is a general foundation of health year. It's called GRD, which is like a general requirements. And then they would change their major in second year to midwifery. So that is what our girls did. So we had to make sure that the standards were high and that we were going to get the very best quality of students into our programs. We were very strict, and we had to really choose our students carefully because we want to really make sure that these students pass all of their courses and graduate altogether, because we're doing the block system of education, similar to the UK. And so they had to demonstrate their passion. And we have to say, these girls were knocking on our door. Miss, when are we starting? When are we starting? Did you get my form? Was it signed? There was such a build-up and anticipation of the program starting. So we actually started in the second week. We didn't start at the beginning just with everybody else, with waiting for approvals, etc. But we started in the second week of the overall semester. And it was just fantastic when we finally all came together. We recruited, like I said, 7 midwives who started in mid-August. And next year, we're hoping to develop the program even further and to move to have up to 30 student midwives if they meet the criteria and they have the prerequisites. The prerequisites that they would need would be anatomy and physiology, and they would need to have very good standard of academic writing because of the kind of assessments that we're using. We're using assignments and similar standards of assessments that you would have internationally, expecting assignments of 2,000 to 4,000 words sort of thing.
So we are actually week 15, can you believe it, in our midwifery program. So like Maeve said, we literally started the end of August, and we've gone through now about 3 to 4 assessments the students have, and they've completed 3 midwifery courses. And we've learned so much on the way. Not only about their knowledge and how they learn, but also about how they can understand the language as well. Because imagine these students, because they're all Emirati, are learning about midwifery, not using their first language. So it can be really difficult, and they're so good at learning the midwifery and medical terms. But actually, there's other words that you know they can sometimes have difficulty with, like students are brought up. What does intermittent mean? What does increase, decrease? What does rationale mean? So if you've got these in a sentence asking a question, then they lose the whole plot about what the question's asking. They understand the midwifery bits, but they don't understand the other parts of the sentence. So we've been learning so much about how to communicate and set sentences to make it a bit easier for the first semester. And what we've done as well is to make sure that in the assessments, that in semester 1, that most of the assessments were about presentations, doing OSCEs, and they did have to demonstrate that they could do documentation for showing their clinical practice. But otherwise we've kept the writing to a minimum, and that's going to progress as the semesters go on until they get to year 4, their final year, and they'll be doing 2,000 to 4,000 word assignments. So like Maeve said, we're going to be striving for 30 students per cohort, but at the moment we've got 7. And we've got 2 lovely labs in our Fatima College. And as you can see here, we've got Lucina, because we've been doing a lot of work about optimizing the normal physiology, because that's all about year 1. And just having Lucina in this position on her knees has created so much talk amongst all faculty, because before this time she was only seen on her back in stirrups, because they used her a lot for maternity nursing, and so it's very different to the midwifery. And also when we've had visitors around from all different countries, they've also questioned, wow, women can have babies in this position. So it's really got a lot of talk and discussions. Yeah. So that's been absolutely brilliant. And the students, this is their norm, to have women upright. They haven't been in clinical practice yet. So it's absolutely brilliant having these simulations. But when we're thinking about normal physiology, we have had challenges when we've gone round to the hospitals doing audits. The hospitals themselves in the UAE are absolutely amazing. There's a really strict culture of dignity and privacy, which is absolutely fabulous. Everybody gets a single room. Doesn't matter if it's an antenatal check, labour or postpartum. But the only thing is that things are very medicalised. There's a lot of care that looks like from America. And so instead of having intermittent monitoring, for example, most women have continuous fetal monitoring. So we do have the challenge, because we're using international standards from the ICM for the competencies. How do we get the students getting these competencies? So we have narrowed it down now to a few hospitals that have really given us reassurance that the students will be able to get these competencies. But if we're thinking about complexes, then any of the hospitals would be absolutely fantastic for this. And that's an important point to stress as well, that this program, this midwifery program, it is the only midwifery program in the UAE that's doing midwifery. There is a master's program that's doing midwifery in the Northern Emirates, but this is the only BSc direct entry. So we've got 3 courses in semester 1. The first one was, is understanding normal physiology, pregnancy and labour and birth and the postpartum. And this particular picture was the first time that we captured the class really interacting with, you can see the diagram on the screen and also the textbooks, and they were also using clay models to make the pelvic floor. So we'll show you some more pictures in a moment, because we've all really had to think about how can we think about the language and helping the students understand. And obviously we do this internationally. We all have to be creative about our teaching, but it's particularly made us think about it, not just focusing on words all the time and PowerPoint presentations, trying to link that knowledge with skills in their hands. And the pelvic floor was really a good example of that, wasn't it?
Yeah, so that's me just walking in to snap a photo. And I have to say that catching Gina in action is just brilliant, because the students, they actually hardly, you can see they're not even looking at me walking into the classroom to take a photo, because they're so gripped by Gina, because she's so passionate about the physiology. And she's actually like, you can't see it there because she's got a mask on and everything, but she's actually singing the words. She puts a little kind of a tune to like, bulbo cavernosa. So she tries to just really engage the students and make them sort of have ways of remembering even mnemonics and various different ways to explain the things and to remember all of the different muscles, and she's really got attention to detail. So I'll just tell you about the other courses that we've been running, which are clinical health assessment for midwives, theory and lab. So I teach the theory and then we both teach the labs, just to give them a bit of variety so they don't get sick of us because there's only two of us. So the clinical health assessment is all around your clinical skills. So things like vital signs, the maternal venipuncture, they've done blood draw, they have done their abdominal palpation, their vaginal examination, care in the first stage of labour, care in the second stage of labour, third stage of labour, episiotomy. So all of those various skills, and that involved obviously OSCE assessments, check-offs, and their documentation and professional behaviour. So they have learned so much. I said to them this week, like, enjoy your holidays, because their brains are just after expanding so much in the last 15 weeks. And really, you have to think that this is completely new information to them. You know, it really is brand new. It has been a different experience to teach student midwives in this country. I do think that you know, when the concept of midwifery is brand new to them, they're loving it. They're really, like I said, embracing the identity and being part of the global village of midwives, which we will talk a little bit more.
And they were so brave, weren't they, Maeve? You know, taking the choice to do midwifery, because this was a brand new course. It hasn't been absolutely fully accredited yet. So they were really brave taking it, and they are very, very passionate about it still.
And they're all really certain about, this is definitely what I want. Exactly. Really love this idea.
And when they were doing the skills recently, before they were doing their OSCE exam, we was talking about signs of labour. So I was saying, you know, what stage of labour do you think this woman's in? And I was like making the noises and things. And I was saying, well, obviously she's in established labour. And we just loved it. It was like such confidence. Well, obviously she is. I was thinking, wow, they're saying this after, like, at that time it was about 12 weeks, wasn't it?
Yeah, they're always surprising us. So you want to talk about it?
Yes, it's just, you know, like I said, because we just didn't want to focus on words all the time and PowerPoint presentations. And the thing is, the culture at Fatima College, it has been historically to really focus on the PowerPoints, but that's changing now. Everybody's trying to get more creative. And when you're thinking about language, you don't, like I keep saying, you don't want to just focus on the words. So here we found clay was really good, because we could make cervix, like you can see, and we was making pelvic floors. We've made vaginas, uteruses when we was doing third stage. We've used balloons, haven't we, for doing the sutures, posters as well. They were doing because Maeve is so creative with that, and she's made some brilliant posters that have gone round the school, and the students have just been mesmerized and also really becoming very creative themselves.
Yeah, so again, this is just more examples. So this is some of our students' work. Again, just bringing the creativity into the classroom, giving them tasks to figure out the anatomy themselves, and they come up with these beautiful illustrations, which I just am astounded by their creativity and their art skills. It's just fantastic. You can see all these beautiful uteri and diagrams, and everything that we do, we share on LinkedIn and we share on Twitter. We would love to share the journey and share the knowledge, share the learning, because we just want to spread the word about midwifery, and anything that we can share with the midwifery education community as well, and anything that other educators might draw inspiration from, that's fantastic. That's really, really beneficial and positive for everybody.
And they're really proud of their work, aren't they?
They are really, yeah. And, you know, even with the other students within the university, obviously we put their posters up on display, and the paramedics, pharmacists, whoever is passing by can see all of that work. And it's really, really, brilliant to showcase them.
And another thing that I didn't mention before is another teaching tool we've used is role play. And it could have gone really wrong. and we didn't know how it was going to go. But what we've learned here is that storytelling is a really important part of the culture. So actually, the students just took to role play so naturally. And in the end, when I said, well, what's the main thing that you've learned today from this role play? And it was about one-to-one support in labour. And then the students said, actually, how the woman feels. And I just thought, oh, you couldn't have wished for better. That was such a brilliant moment, wasn't it?
It is, yeah. And even, putting the balloon up their top to pretend like they're pregnant, yes, and getting in the, really getting into character, And I think that's a testament to the bonds that they forge as friends themselves as well, because of course these girls never met each other until this class. They came from different majors. So just to say that we took students who were on a paramedic track, on a nursing track, on a radiological medical imaging track. They were all from different professions before, and they now come to midwifery. So they didn't know each other before, and they've become very firm friends, I think, over the last 15 weeks. So just to showcase some more of their work, and we're really proud of their poster assessments, just to show you the level of their work. This is one of our student Fatima's posters. You can see some of the things that they've chosen to present. So this is a poster on abdominal palpation, one of the skills.
And we presented them at the open day as well, didn't we?
Yeah, so we've used these posters. They're obviously up on display around the university. And again, they're a talking point when people walk into the university. They're very much on display. And recently for recruitment as well, we've had them up to talk to future potential students as well about the kinds of things that we're interested in talking about. So this is a really beautiful poster by two of the Fatimas. Three of our students are called Fatimas, so this is by two of the Fatimas, about water birth. So this is something that we're really interested in strengthening here in the UAE, because there is potential to have a lot more opportunities for using water in labour and birth. So I think that having this knowledge is really important for the midwife, or for student midwives, to bring into the clinical practice as well, and to discuss the options with the women. Because at the end of the day, I think it's going to come from the women. The demand for water birth will come from the women looking for choice.
And because, again, we're using international standards, the students are learning these skills. And just like they're learning skills about, it's just geography where we give the care. So they will be prepared to give care in the community, which at the moment, most hospitals do not provide community care to women at home. Once you leave the hospital, you have to come back to the hospital and see an obstetrician postnatally, if it's for the mother, and then you see a pediatrician if there's a problem with the baby, or a lactation officer or consultant if it's about the breastfeeding. So there are hospitals in Dubai that have started doing community midwifery care, which is so exciting. And we know there's lots of talk about it in Abu Dhabi as well. And really good services with parentcraft as well going on in Abu Dhabi, isn't it? So it's going to be brilliant for the students to see.
Oh yeah, it's another one. I breathe in my power, I exhale my fear. That's Sharina's poster. Again, just really creative and really informative as well. I think that's something that could be displayed in any clinical unit, and very useful for women and for staff as well.
And so again, these are from their final presentations for the normal physiology course. And it's just showing you that if you look at the headings, they're just internationally what you would expect in midwifery. And one of them, because when I was talking about my moments, that I was like, oh, when you just feel like you're going to well up. And one of the students, because I'll go to the beginning, when they were doing their presentation, they're talking about the anatomy and physiology, but then they had to translate it of how they would explain that to the woman. So most, they all did a brilliant job of saying how they would translate it. But one student, Huda, she actually went that extra mile and made a little film. So this image on the right at the bottom, she's actually made two little puppets. and has got a background there. And every time they spoke, she was moving them. And one was saying that she had abdominal pain and discomfort, and what is going on. So she was literally explaining about how the uterus contracts after birth, and it was just so amazing to see that they're actually critically thinking and making sense of the information that they've been receiving. So yeah, it was a really good moment.
Oh.
Yeah, and then we've had simulations, haven't we? So I think the last time we spoke to you, I think we was either preparing for one, wasn't we? Or we had just done one, and it was about a normal, no complexities, a birth that happened. Oh, it didn't happen at home, did it? No, it didn't. She started labouring at home, and then we did the transfer to hospital, and then she had a vaginal birth in the hospital. So we showed the one-to-one care, didn't we? This time we did one that a woman was labouring and birthed at home, and then transferred into hospital, and she started bleeding. So it was a bit more of an emergency situation, wasn't it? And this is Maeve. This is her teaching face with doing the reflection after the simulation and just thinking about the learning around it, because it was quite shocking, seeing somebody just flying in on a stretcher, because it was very real, and we had the paramedic students helping us as well.
Yeah, and we were always supported by Leader Healthcare, who come in and provide all of the equipment. So they have some really high-tech equipment, the Body Interact. They obviously have Lucina, and they provide all of the mannequins and the direction for us. So it's really brilliant working with Leader Healthcare. So that's me in action. And then this is Maxine and Shay, and they are there with Lucina, who has just given birth at home, and they are just after catching the baby, and they're just realizing that she's starting to bleed, and they're just phoned the midwives now to tell us that she's given birth at home and should they bring her in. And Gina says yes, bring her in, and then let's see what happens next.
Afterwards. Okay. Hi, this is Lucinda. She's a 19-year-old lady. This is her fourth baby. 18-year-old.
Okay, so that's just a taster of what you can see. So we have a simulation suite there, which looks just like a normal triage. And you can see all of the photographers that are there and all of the students that were involved. It was a brilliant student engagement in the event. And this is actually held outside of their student hours, isn't it? It's brilliant that they actually stayed back, because there is a lot of excitement around the work that we do, and they really do kind of support us, don't
Absolutely.
they? It's fantastic that they're really keen and interested.
And it's a great marketing for what a midwife does as well, because we've shown, when there's no complexes, everything's calm, follow the woman's body. But when there is a complexity and it turns into an emergency, a midwife is there and she can go into action. She's got the right skills as well. So we're giving a really good message about our skills.
So we're going to move on now to our networking and collaborations. This is the final kind of part of our presentation tonight. And we were really excited recently to host a group from the American College of Nursing Midwives, which are led by the president there, Dr. Kathy Collins-Fillet, who's on the bottom, second from the left. And again, we shared a lot of our learning. We shared our journey with that team of academics. And we also brought them to meet our students. And I think this was really influential for our students, because they really felt, wow, we're part of something. The only two midwives aren't Maeve and Gina. There's a world out there. So it was really fantastic. And the group that came were varied experiences, from 1 year qualified right through to the experience level of the president of the ACNM. And they all imparted various bits of knowledge, and they shared their experiences, and the students really did open up to speak to them, and we showed them the simulation suite. And like Gina said, they wondered, how did we get Lucina on all fours? Well, me and Gina have been weightlifting. So we were very strong. So many people could not lift Lucina into all four position, but we managed to. Where there's a will, there's a way. But it did actually trigger a lot of discussions around our simulation and what the students were learning. So that was really, really interesting.
And I think people are leaving us thinking that they're going to do these things as well, you know, so it's really good that we could have just been a trigger for something.
Yeah, and just to show that things are possible. So this is again a lovely photograph of all of the attendees from the Nurse Leadership Forum that was in Dubai. So again, the midwives are following our journey, and Obix Healthcare sponsored this leadership forum and invited Professor Hannah Dalla to share her journey in leadership. And then there was a panel of myself and Cardiff University just to talk about midwifery in Abu Dhabi, and it was really exciting, and there was lots of engagement and passion came through. We had some fantastic midwifery leaders in the audience. The discussions were incredible. The passion, the energy when we left the room, everybody felt felt energized and motivated when we left the room. And as a result of that, really, the Burjeel Farha conference came about, isn't it? Because we networked, and we've had that conference just recently, was it last week or the week before, following on from this, because there's so few midwives in UAE. It's like a little small community, and we're just getting to know each other now, so it's brilliant.
And because of COVID as well, people haven't come face to face. So this, I think, was the first meeting of midwives for so long. So everybody was like, what's your telephone numbers? Everybody was exchanging.
I just want to show you one of the midwives in the middle there with next to Hannah Dallin in the pink. Mariam, she is just incredible. She is such a dynamic upcoming young midwifery leader. Her research area is perineal care. So she was really passionate to talk to Hannah Dallin and share her master's research. And she presented at the Burjeel Farha conference as well, talking all about the strategies that we can use as midwives to prevent perineal trauma. So just to highlight Mariam's work.
And just such a good role model for our students to see midwives like this.
So we've also been, we're part of the Emirates Nursing Association, and as part of that, they have reignited the passion for the Midwifery Society. Again, I suppose during COVID, all of that died down with the midwives being under pressure clinically and maybe not having so much time to devote to societies, associations. So we were asked to attend the ICM MRO regional meeting last week, which was really exciting. You can see that image still from the Zoom meeting last week, where we met with Mandy Forrester, Dr. Roa, and many different members from the ICM. You can see Sally Perriman and Franca Caddy. So it was just really, really exciting to be a part of this collaboration, and the possibilities are really, really exciting as well for the future. So we have an abstract accepted for the ICM conference in Bali next year, and that will be an exciting thing.
Yeah.
And yeah, so that's really exciting to build all of these networks and to be showcasing midwifery in the region.
So in the last year, we have made so many connections. And so we've got about 20 midwives that we're very, very close with. And anything that happens now, we're on the WhatsApp, and everything snowballs then for other people to be informed and get involved. So anytime there's anything that's going on with midwifery, we try to be there, don't we? Just to be part of it and get to know the circle of midwives that are available in the UAE. And we're having so many people contact us through LinkedIn as well and other means of social media asking about working at Fatima College as well. So that's really good, because we do need more midwives to work with us, because we can't stay with two of us, can we? So we do need some more help, because we actually want to make the course bigger. We've got 4 campuses at Fatima College. We've got Elaine, Al Dafra, Ajman, and we've got Abu Dhabi. So the program is running in Abu Dhabi at the moment. So we do want to expand to the other sites eventually.
One of the other opportunities that we had was to be part of the regulation. So you can see there the second LinkedIn post there was about the UAE National Workshop for the Roadmap for Implementing the National Strategy. And that was a really important meeting to be part of, because we were looking at the scope of practice of midwives, and we were looking at the scope or the professional titles. And I was the only midwife present at that initially. And then I invited Caradine, quick, come on the second day, because we need another midwife's voice. So thank you to Caradine for coming at the last minute to the second day. But it's just numbers of midwives. You know, it's difficult when everybody is working hard. I happened to be passing by Dubai the night before, so it happened to suit me to go to that meeting. But we really do need more midwives, and I think it was really important to have midwifery voice represented at that regulatory meeting, and just to recognise again and disaggregate the nurses and midwives, and to make sure that there is a midwifery voice at that level. So it's really been a brilliant opportunity.
And as part of the accreditation, we've engaged with all the hospitals, you know, speaking to the doctors, speaking to the midwives, the managers, nurses. But one thing that we really need to work on is engaging with women. That's what we need to do. So we're going to actually get the students. This will be our story next time, telling you about it. We want to go into the community now and start giving some health promotion with the students. And just start, you know, speaking to women. What do they feel about midwives? Have they ever heard of a midwife? You know, and introducing the concept and seeing how they feel about it. Because actually we do have to get the public ready for our student midwives, because they're going to qualify in 3 years' time, you know. So and hopefully the workforce is going to get bigger, because we're going to have 30 recruits each year, if not more if we expand. So we've been presenting at the conference. If we're not attending, we're speaking, aren't we? So we've been online at the Corniche Hospital. Is very, very lucky to speak there. So you were speaking about your research, wasn't you, Maeve? And I was speaking about you know, what we found in Abu Dhabi. And then we were speaking at Virgil as well. So we was just talking about our research again. And it's just getting out there about what midwives are doing. So it's not just what we're doing locally, but internationally as well. And just thinking of different ways of thinking, different ways of doing as well in midwifery, and sharing the research. So it's been absolutely brilliant. And then thinking about their Emirates Nursing Association and the Midwifery Society, they have been really good connections, haven't they?
Yeah,
Khadija
exactly.
and Avon. Really increasing our knowledge historically about how midwifery has evolved, because there's a lot of government support. You know, this is not new, the support for midwifery. If you look at the government policies, there's been a push for over 10 years to increase midwifery and nursing numbers. And with nursing, they have been so successful. So now the push is here now for midwives. And it's looking really hopeful when you look at the nursing numbers, isn't it?
Yeah. Okay, so what next? Where are we going? What will we be talking about the next time that we meet you? And what's in the future for us and for our students? So like Gina said, we're really keen to get out there into the community, to drive some awareness about what is midwifery, and to get our students engaging with pregnant women, because so far they've just been in simulation in the lab, and they really are keen to meet women and to start actually engaging with midwifery itself. We're also obviously involved in the Emirates Nursing Association, raising the profile of midwifery there in the Midwifery Society. And then we've been working on this placement document, which we're going to call the
Adora. And actually that came from our last presentation here, wasn't it? Somebody in the audience actually said, why don't you call it the Adora? Because we got the Mora in England. And actually they said, well, if you're going to have it, it's Abu Dhabi. And actually all the other sites that we have for Fatima College begin with A, so it will still go with it. So it's going to be a booklet, as an assessment booklet for when they go into clinical practice. So we're actually going to be really working hard on it in the next semester, aren't we? We've actually got allocated time for it, but we're so lucky because we've got help from Kingston University, Lindsay, and Heather from the RCM. That's helping us with it. But also we had our first midwifery advisory committee meeting last week, which was really exciting. So you can see we've got our pictures of us up there, and literally everybody but one person came. So that was really, really fabulous attendance, and so passionate as well. And one of our students was there as well, which was absolutely fabulous. So it's just we're making sure that with the clinical placement document that it's going to suit the hospitals as well as the academics as well. So we're looking at the midwifery education resources. So leadership, healthcare has been helping us what mannequins that we should get and how we should redesign the lab. So that's been really, really helpful. Textbooks, we're just thinking of the future of those, which ones, because we've got the Maze and the Miles at the moment, and we've got skills books, but we need to think more in depth about that. And year one is all about normality and, you know, looking at issues that where there's no complexities at all. But year three is going to be all about complex care.
So I will be looking at the complex care with the students next year. So we'll be really knee deep in that in the next semester, and then we'll have the ICM conference in June. And then disseminating our findings. So we do have a paper under review at the moment, and we are obviously sharing our journey the whole time, including the blogs, the Midwifery Forum. And we are looking forward to hopefully supporting our students to get published in the Student Midwife Journal as well. That would be a really nice achievement for them. And just again, feeling part of that global midwifery community. So the future is bright.
Fantastic. Thank you very much.
Thank you.
Thank you for having us.